Honourable member for Courtenay-Alberni.
Well, thank you, Madam Speaker. And Madam Speaker, we know the mental health crisis has been referred to as the parallel pandemic. This House has not had a debate on how to respond to this. And earlier this month, you know, I rose and sought an emergency debate on Canada's mental health crisis, but that unfortunately was denied here, Madam Speaker. And I do want to thank the Minister, as she acknowledged tonight, we've never had this conversation about mental health till tonight, and that we've never had a proper debate. And I want to thank the Conservatives and the Bloc and their House leaders for agreeing to have this important conversation, because it took all parties agreeing to do this take note debate. So I want to thank them. Now, you know, we know that over the last 2.5 years, the mental health of Canadians has been negatively impacted by the loss of social isolation and financial strain the pandemic has brought. We all have constituents struggling with their mental health. And many of us have loved ones who are as well. And my good friend from Vancouver Kingsway always says that there isn't a family not touched by the mental health or substance use crisis in this country. And I really want to thank my colleague from Cariboo, Prince George, sharing his personal story and about his brother Kevin and his brother-in-law. And those personal stories that we hear as parliamentarians from our constituents, we hear every day, and it's painful to hear. And, you know we're going into a period where we're seeing a lot of impacts right now on people's health. The cost of living is rapidly rising, and likely we're going to see a recession, and the stress Canadians are facing, it's not abated. Just yesterday, the Minister of Finance warned Canadians are having difficult days ahead and suggested the federal government might not be there to help. But it's now more than ever, Madam Speaker, we must recognize that mental health is health. And we need to take steps to ensure Canadians have equitable access to the services they need. And this month, the Mental Health Commission of Canada and the Canadian Centre of Substance Use and Addiction, they released a joint report on the continuing impacts of the COVID-19 pandemic on the mental health of Canadians, which detailed some alarming findings, Madam Speaker. And according to polling conducted for the report, 35% of respondents reported moderate to severe mental health concerns. We see that, Madam Speaker, as parliamentarians. It also found that fewer than 1 in 3 people with current mental health concerns access services. That's alarming. The report identified key barriers to accessing services as, quote, financial restraints, not having readily available help, not knowing and where to get help, and long wait lists, end quote. The report identified financial concerns as a top stressor during the pandemic and discussed the links between income and unemployment with mental health concerns. Now, given the current economic forecast, there is a real risk the mental health and substance use crisis will worsen in the months ahead. And that's scary, because as my colleagues have identified, 10 Canadians die a day from suicide, 21 from a toxic overdose. We also know that healthcare workers have been raising the alarm that our healthcare system is under tremendous pressure, as well as first responders. And unfortunately, too many people struggling with mental health issues are left with nowhere to turn but crowded emergency rooms. A worsening mental health and substance use crisis will only push our healthcare system closer to collapse. It's clear we need to make sure people can get the help in their communities before they're in crisis. Now, while there are many great organizations working hard to support Canadians struggling with mental health issues, we know they are running on fumes. The demand for mental health services has increased since the onset of the pandemic, but that demand cannot be met under the current system. When frontline organizations are having to worry about keeping the lights on, they need help. They need help now. We need system change that will finally bring mental health care fully into our universal public healthcare system once and for all. And we need sustainable funding to ensure all Canadians have access to services when they need them. Thank you. Now, in the last election, the Liberals made a promise to Canadians that it would take steps to improve access to mental health care in Canada. A cornerstone of the Liberal promises on mental health, Madam Speaker, was to establish a new permanent transfer to the provinces and territories to expand publicly funded mental health care and address backlogs. Canadians were told An initial investment of $4.5 billion over 5 years will be made in the Canada mental health transfer. Now, $250 million of that funding was supposed to be delivered in 2021-2022, with an additional $625 million in 2022-2023. To date, no funding has been delivered of that money, and there has been no transparency from this government on when the money will get out the door. So last week, Madam Speaker, the Canadian Alliance on Mental Illness and Mental Health, with the support from 65 organizations from health and allied sectors, wrote an open letter to the minister expressing concern about the delay in establishing the mental health transfer and calling on the government to take immediate steps to fulfill this important, critical campaign commitment. Now, the minister has taken the position that national performance standards must be developed prior to the creation of the Canada mental health transfer. However, the open letter I referred demonstrated that there is a clear consensus from the mental health community that the development of these standards shouldn't delay the Canada mental health transfer. There is urgent need for increased mental health services in communities right across the country. Wait times for publicly funded mental health services are unacceptably long. Now, in Ontario, where we're standing right now, there are more than 28,000 children on wait lists for community-based mental health services that can range from 67 days to more than 2.5 years, depending on the service, exceeding clinically appropriate wait times. For children and youth, delays in accessing care can have lifelong impacts for themselves, their families, and society, and tragically, it can also be a matter of life and death. According to Stats Canada, suicide is the leading cause of death among youth and young adults aged 15 to 34. This has touched my life and many people here in this chamber, as we've discussed tonight. And UNICEF has reported that Canada has one of the highest rates of youth suicide in the world. We've heard my colleague from Nunavut just 2 days ago share that tragic story of someone who couldn't find housing. This is unacceptable in a wealthy country like Canada. It's preventable. So for those struggling with substance use disorders, waiting can also be a matter of life and death. And across Canada, the average wait time for adult residential treatment for substance use is 100 days. Every day someone must wait for access to treatment or harm reduction services. They are put at risk because of the toxic drug supply. The Canada Mental Health Transfer would provide an infusion of funding for services that can save lives now. It is urgently needed, Madam Speaker, but there is other critical work that must be done to transform mental health here in Canada. Beyond the mental health transfer, mental health advocates have been long calling for legislation to enshrine law parity between mental and physical health. Last month, I tabled private member's motion M67, and I hope my colleagues will second it, to call for the government to finally develop that legislation and urgently fulfill its promise to establish the Canada Mental Health Transfer. I hope all members of this House will recognize the crisis we're in and support these urgently needed calls to action. Untreated or inadequately treated mental health carries significant social and economic costs. The Mental Health Commission of Canada estimates mental health issues and illnesses cost Canada at least $50 billion a year, not including the more than $6 billion in lost productivity. Relative to the disease burden caused by mental health and compared to G7 and our OECD peers, Canada is underspending on mental health. France spends 15% of its healthcare budget on mental health, whereas the UK spends 13%. Canada, depending on the province or territory, is between about 5 and 7%. We're falling way short. So for the well-being of Canadians, for our economy and our communities, mental health can't wait. It's time to invest in the care Canadians deserve and to truly treat mental health like health. And we need to listen to the experts, Madam Speaker. We need to listen to the expert task force on substance use. We need to listen to the 67 organizations, and I hope that we together can do that. Thank you.
Questions and comments? The Honourable Member for Don Valley East.
Well, thank you very much, Madam Speaker, and I want to thank the member for his words. And question I wanted to ask is, You know, what can we do as federal members, working with municipalities, with provincial bodies and organizations, to better coordinate our efforts? Because that's one of the biggest challenges that we have, I believe, as parliamentarians, from provincial, territorial, federal, and government's coordination. Any advice to this House on what we can be doing differently?
The honourable member for Courtenay-Alberni.
Madam Speaker, that's an excellent question, and I want to thank my colleague who had the courage to support my bill and listen to the experts on substance use. Bill C-216, a health-based response to substance use. Madam Speaker, it's listening to the experts, listening to the local knowledge. There is local knowledge in this country, listening to Indigenous knowledge about how we move forward. Those organizations, the 67 leading organizations, they're ready to deliver mental health now, actually, Madam Speaker, but they're literally on fumes, as I stated. And injecting the mental health transfer, getting it out the door to those local experts will save lives. We have an opportunity to save lives right now. If we come together collectively and not wait for everything to be perfect, it won't be, Madam Speaker. What we do know is those organizations save lives now, and they can prevent the loss of further life. We need their help, and we need to listen to them.
The honourable member